because your personality is too good to waste.
Aw, Robert, you don't mean that.
Hello and welcome to HealthCast 305. Today we have Dr. Nick Vernola. I graduated from undergrad with this fella, and he was an intelligent man. Let me tell you, he was raised by wolves in the background of a small Ukrainian mining village. This was after the nuclear meltdown. So these wolves had superpowers. They were ethereal. He started out studying kinesiology with concentration in exercise science at SUNY Cortland, the undergrad school we went to, a school for bodybuilders as well. And
it escaped me somehow. I mean, definitely.
He was immune to it. But I remember you specifically correcting me on some of my form one time in the gym. It was a deadlift. It was a deadlift too, but I remember one with my shoulders. I was doing like high pulls above the head, and you're like, "That's gonna damage your rotator cuff." And I was like, "What's my rotator cuff?" And this was when we first started.
I just knew way beforehand. I was just so ahead of my time.
They're gonna change the name from cuff to cup. But yeah, once we went to PT school, we learned all the cup versus cup. And,
you can drink from it, I'm pretty sure. The rotator cuff.
You probably you could.
Like the Holy Grail. You
get a scapula and you hold it and just drink out of it. That's like what you do with the people you kill in war. So during PT school, Nick actually traveled to the States, taking on pelvic physical therapy and some educational courses shadowing urologists and gynecologists. He practiced under one of the leading pelvic floor PTs in the Northeast. And he's now working in Atlanta, Georgia. He created his own business just like me. So he's following in my footsteps. Although he might have opened insane. Like many people do. And yeah, just as insane. He's taking the risk. And so he uses his knowledge and skill sets in exercise science and pelvic health to bring a unique, comprehensive take on pelvic-related treatments. So Nick is our pelvic floor guy today. We haven't had anyone like this on before. In our long history, 5 episodes, we've had 0 pelvic health people, and I think you'll find it pretty interesting what he has to say, everyone. So if I haven't already introduced you enough, because I know so much about you, is there anything else you'd like to say about you and your business, Nick? Let's hear it.
Contrary to my upbringing, I did not incorporate wolves into our logo.
A lot of people find motivation in the fact that they can put some of their upbringing stuff in there, like a flag of their country or their coat of arms. True.
Instead, I put a pelvis.
That's so dumb. Could have at least been a wolf pelvis. Who's gonna know the difference?
Yeah, that's true. I mean, I guess technically I should be able to tell the difference if I saw the two.
You could, yeah. No one else, hopefully. Wait, so let's start off with the basic question here, because a lot of people don't even know what pelvic health PT is. I remember the first time I heard anything about it was like in undergrad, and someone mentioned how they had a bad pregnancy and had to go to a PT for something, and I was like, oh my God, PTs do that? Because I had no idea what was going on. I didn't even know what the rotator cuff was. So what did first of all, like what is pelvic health physical therapy? We'll start with that one. I have so many questions to ask.
Pelvic health physical therapy, I mean, it has all to do with the pelvis. It's really just kind of bringing in one more body part into your function. I mean, sometimes it is as isolated as we're just looking at the pelvis, but that's actually really rarely the case. It's kind of just bringing in the pelvis into the full functioning kinetic chain of things that we do. And a lot of people think when they hear pelvic health, I think the most common thing said to me when people find out that I do it is, oh, so you work with a bunch of old ladies trying not to poop themselves? And that's, yes, I do. But that's not exclusively it. As a matter of fact, people who are really active, I mean, from any range of ages and genders, wind up with things where they need training of their pelvic floor to be integrated into their whole body. So like your people who are CrossFitters who are peeing themselves when they do their double unders, Do you know what the double unders are?
Yeah.
The little one.
That's the
So in CrossFit, double unders are the jump rope where you do like 2 spins. And a lot of people have an issue with that, but like holding their urine when they do that one. But I was just bringing that up because it's something that people don't talk about, but it's super common.
Yeah.
It's way more functional and for like active people than people realize, pelvic floor physical therapy.
Yeah, I feel like most people would probably just ignore those problems. The big, oh, that makes me pee myself.
Yeah, I mean, they think for whatever reason, they think it's normal. And I'm pretty sure, I mean, I'm just speculating here. It's because people get into their groups of friends, and maybe they'll start talking about like, oh, you do that too? Yeah, it only started ever since I was pregnant and had a kid. Oh yeah, me too. That must mean it's normal. So like people kind of get into this like social group of, validating for one another. And then they won't do anything about it. And there's really not much, I guess, besides surgeries that's going to be done at the gynecology office because they're not musculoskeletal experts, right? Mm-hmm. So, that's where pelvic floor physical therapy comes in and educating people. And that's why I love doing podcasts like this, because then someone listens and like, oh man, that sounds like me, or oh, that sounds like Janice, or oh, that sounds like, I was trying to think of a guy's name. Robert.
Oh my God, HIPAA. Robert Poliszuk. I mean, what? All right, so you see a lot of different people, it sounds like, and I think one of the biggest myths out there is that people think it's just an issue for girls, but that's not true, right?
No, definitely not for girls. Go check out my penis pump video.
I saw that yesterday.
It's only mildly pornographic.
That's what we need.
Not pornographic at all.
You gotta get an OnlyFans account to watch it, I heard. You're selling. Yeah, it's okay. 2020, man, you got to make your money somehow. PTs or not, that's how it is. Yeah, so it's not just for the penis pump video. Like, so I mean, in what situation would someone need that kind of work, penis pump work?
So I mean, it's more like a suggestion, and a lot of people I like when they use it after their prostatectomies because it's a way to make sure that blood flow is still getting to the penis and keeping the erectile tissue nourished, as well as the muscles that surround the penis and help with the erection. So people with erectile dysfunction, maybe people who have tried Viagra and just don't respond well to it as a drug. So it's a nice alternative and a fast one to it that, you pump it up. I don't know if you saw the video, but I mean, it looked like a blood pressure cuff. I
was blushing too hard. I had to go away from it.
Oh, okay. Well, you needed a penis pump. All the blood was in your face.
I had to go. Yeah, right. Exactly. That might be the issue, especially when patients are working with such a handsome fellow like you. So, so you have to cover a lot of bases with your knowledge there. What was that like in school, learning all that stuff? I mean, it's got to be tough being a guy in that field, right? I mean, what's the percentage of women and men?
Ooh, I don't exactly know. I do know that it's really well represented by female physical therapy. But when I went to my courses, I was the only guy. And I'll tell you, by the classmates, I was treated very well. By the instructors, who are also very nice, I really got treated like I was there as a sexual predator. They put me in the back.
No.
Yeah, I had to bring my own lab partner. They put me in the back. They put a curtain around me, so I guess in case I was trying to look around or something.
Oh gosh.
It was. I'll say that part of it was kind of humiliating, being put in that situation. But you get through it. I made so many friends through it. Everyone was really nice. Like, I didn't have any bad experience with the people there. I think it was just maybe that company's protocol is a little dated, maybe.
Yeah. Well, it's tough nowadays with all the things going around, but but to stick in it after all that stuff must mean you really liked it, huh?
Oh yeah, no, I love it. I mean, it's like I said, it's just that missing piece to what we do as physical therapists that people absolutely need. Nobody wants to talk about. I mean, and you know me from college, since college, there's nothing I won't talk about.
No, this man is crazy, people. He'll talk about anything.
So it was a fitting subject for me because I really like connecting with people and just talking and being weird. And
Yeah.
as long as you do that.
I'd say it's good that that's what you're doing, because I'd rather have someone that's sociable and goofy doing it and very smart than someone who is like really socially awkward and callous. Because I feel like these people need that kind of like that funny release thing, or or else they're gonna feel kind of alone and awkward the whole time they're dealing with this stuff.
Is funny release anything like a trigger point release?
Yes, I've tried it. Honestly, it works. It works like that almost, right? I mean, when you make your patient giggle, it can make everything feel better. I'm not sure how it works in the pelvic floor.
Isn't that the truth? Isn't that the truth? So your rest and relax nervous system, right? Like the parasympathetic versus the sympathetic, where we're all up and tense.
Yeah, true.
It has been shown empirically, that being able to calm down, and it's something that helps with muscle tension. So I think you're onto something.
Yeah, maybe we should just have a comedian come into the clinic, and then he can just tell jokes periodically throughout the whole time. But that's where we come in. We can just cover those bases because we really understand our subject matter. We understand our crowd. We can make jokes particularly for them. So explain again. You were talking about the double unders earlier. Explain, because I think this is a big one with pelvic floor. I don't. Obviously, I'm not a pelvic floor PT, but I'm assuming that incontinence is a big one, especially in the population. Here in Miami, we have a lot of athletes and people who exercise a lot because we got to look good because the sun's out so much. There's this term that we've created here that I don't think you've ever heard. It's called "suns out, guns out."
Never heard of it.
Yeah, it's when it's sunny outside, you get a weapon and you brandish it. And when you're doing that, you have to have good muscles. Yeah, that's and your bicep will show because you're
holding it up.
Yeah, so we like to be very fit. So I don't think people really know what incontinence really is because there's a few types of it, and I think that there's certain kinds that affect certain populations more than others. Am I on the right track with that?
Absolutely not. No, yeah, you are.
This man's an idiot.
No, yeah, you're right. There's a lot. So the four types that I'm most familiar with are stress incontinence. So first of all, incontinence is losing pee or poo, but more often we talk. We'll talk about urine for our purposes. So losing pee, right? Yeah. There's stress incontinence. There's urge incontinence. There's mixed incontinence when it's those two together, and then there's functional incontinence. So stress incontinence would be stress like you cough, sneeze, or you lift something heavy and you lose your pee. Urge would be like Pavlov's dogs. I heard a bell and I just lost control and I peed. Wow. And then mixed, like I said, would be something of both, put together. And functional is when someone, not necessarily that there's something wrong with the pelvic floor as much, but maybe they have poor balance. So they don't want to go to the bathroom because they're afraid they're going to fall and hurt themselves. So they just wet themselves more intentionally than anything. So that's the functional one. So those are the four classifications that, like I said, I'm most familiar with. The one I'll see most often though, so where you were asking about those double unders, that's your stress incontinence. So that's the one where people are jumping, there's gravity pushing down every time they hit. A lot of people like to Valsalva, hold the breath, increase that pressure in their abdomen. And then, if the pressure's not coming up and out, it's going to go down and out. So that's where that urine release comes from. They're muscles like any other.
Yeah, right. And the structure of it, I mean, I'm assuming that when you deal with pelvic floor patients, you're looking at the pelvic floor area, but also like the surrounding canister above. Because I've taken a course where they talked a little bit about this stuff, where it's like we hear so much about engaging the pelvic floor or like the transverse abdominis. But if you think of powerlifters that are squatting like 400 pounds or CrossFitters who are doing intense exercise, are there any general cues that you like to give or use with those people to make sure that they're not doing that kind of Valsalva, which pushes everything down and just, which I would assume would kind of make saggy and not as strong, the pelvic floor muscles, right? Make saggy.
Yeah, I mean, for sure, it's going to weaken the pelvic floor from the constant strain. Maybe not doing it once or twice, but if you're CrossFitting every week or heavy lifting like that every week, absolutely. I mean, think about, you got like Atlas holding the weight of the world up on his head, but if someone was up above jumping down on it every time, he's going to weaken and he's eventually going to fall, right? He's going to get way more tired than just sustaining. So what I wanted to say, oh wait, I lost my train of thought actually, because I was so excited about going like this.
I knew it seemed like that seems like an example you use a lot, and you're excited to whip it out right now.
No, I was.
You were talking about the pelvic floor and how it can get worn down, but I guess that's
the cues. I'm sorry, that's where I was going with it. So the cues, the biggest cue that's more important, that I believe is the most important, is the breathing, for sure. And I think a lot of people will talk about that, but making sure that the pelvic floor gets that rest, because what I was trying to say was, since there's all this gravity above pushing down, if you're going to add one more thing to strain it by increasing the pressure pushing down from above as well, just from what you're building by holding your breath, I mean, you want to give it every chance it has its success, your pelvic floor. So we'll go over, I mean, you can see I have my squat rack behind me in the office. We'll go over actually going through these movements and when to breathe at the right times, when to breathe during the double under. We'll get the jump rope out and start working on that. So just kind of the first thing is typically function, like making sure we're getting the function down of the breathing, so that way the pelvic floor can rest. And a lot of times, after they get that down, I mean, we don't even need to touch the pelvic floor. Things kind of start to come back naturally.
Yeah, it all falls into place.
What if you did bicep curls every day? Never rested.
Yeah, eventually there'd be an issue. I'd probably get some sort of tendinopathy in my elbow region. It'd be no good.
No bueno.
So I had this question in my mind for the last 15 seconds. I'm going to lose it, so I'm going to go over it now. I don't want to do it. Yeah. When you are teaching breathing, what is like the first couple steps you use with most people? I know that's a very vague question, but for example, when I'm working with people, I see a lot of chest breathers, and I try to get them to breathe more with their diaphragm, at least bias it more that way. It's not like it's a pure transfer, like, oh, you're only using your diaphragm. This is beautiful. Your body's functioning perfectly. It's like I'm just having them breathe a little bit more with their stomach going up and down, and pushing out radially, like in the midsection, which is where I try to aim for people to breathe, because typically I see people breathing like this and they have trap pain and everything. Yeah, and so I try to work on that. How do you work with people in that sense?
Similarly, I mean, we start out with something simple, just trying to figure out where the diaphragm is, how do we activate it independently. We'll use it functionally. So, I mean, maybe I think you said you have them lie in their belly and push out. So that's a good way to try to actually engage the diaphragm, the respiratory diaphragm, a little bit more. Sometimes I can provide resistance. I'll tell them to go home and take out their textbook from college or high school that's just collecting dust, place it on their belly, and breathe to raise up and down the book, to just add a little bit of resistance.
Yeah, that's cool.
And then, they're getting a little lesson too from their textbook as well.
Open it up if they need to, right? It's like sleeping on your book before the test.
That's how I got through PT school.
Don't tell anyone that.
And then, we'll progress into the functional thing, and always working on the pursed lip exhalation. So that way we can get a little bit of that, more of the transverse abdominis. So it's regulatory for the way in and the way out. And then just bringing it, like I said, into the gym, like getting them up off the table. I don't want to keep them on the table very long. I want to get them up and transition them into those more functional things. And we'll work through different exercises, when the proper breathing is, and then eventually we'll get up to maybe the squat rack, or if they're doing the kipping, what are the kipping pull-ups, a lot of CrossFitters.
Yeah, I was gonna say CrossFit is definitely a high demanding task for people, and like you said, it's like it's a repetitive. They gotta sustain like core stability and strength throughout a whole range of lifts. So I could see how that would be an issue for like a normie that wanted to start working out again. A NARP, as they say. I wouldn't know what that is personally because I'm not one. But no, I just deal with them and I have to no.
I don't even know anything about it. No,
Alienating 3/4 of my patient base right there. I'm obviously
is it
joking.
really? Oh,
Well, maybe not actually with me. I mean, I treat Medicare, so typically it's hard to find like extremely active Medicare. Not that it doesn't exist.
I was gonna say, I mean, they definitely people who have Medicare, they'll CrossFit for sure. It's one of those things that people like to get into because it almost has that competitive aspect to it. And I wanted to touch on the fact that a lot of it's timed, and that's why people try to compensate so much. So they're trying to hit their personal record by lifting more and lifting faster. So that's where the Valsalva comes in, that breath holding, is that they're just trying to beat their time from the last workout of the day, the WOD.
Yeah, you know, right. Yeah, the WOD, the endless pursuit of the WOD record. I did do CrossFit for about 6 months here in Miami, and I enjoyed it. I was very good in some aspects and very bad in others, if you can imagine. I was like near the records for all like the strength things, like the gym records, but then
I can see the pull-ups. Yeah, absolutely.
I definitely
bombing.
Can I do 5 more squats? Let me do 5 more squats. But then of course there were certain parts. I mean, that's just how it is. Everyone has their specialties, and like you said with the WODs, I think people are trying to achieve things that they might personally not be able to do in a healthy way, and especially for their pelvic floor, it might be damaging. Not damaging, but it could throw them off a little bit. Yeah. So how do these powerlifters, these really strong powerlifters or strength athletes, how are they not freaking blowing out their pelvic floor? I mean, it's insane the amount of weight they're lifting, and you see the Valsalva, and it's like a full-on huge breath. Their bellies are pounding out. They have a belt on, squeezing it down. I don't understand how these people aren't being destroyed. I mean, obviously, like with everything else, you get stronger and you can handle it, but do you see powerlifters at all, or have you heard of powerlifters having these issues?
So the thing I see the most with either powerlifters or people who have to lift heavy for a living. So a lot of my factory workers that work for grocery stores, typically, they're actually paid on productivity for like how much they can move, and the boxes are like 50 pounds. I think up to 50 to 75 pounds. But anyway, so that's not quite as heavy as the powerlifters. But I will see a lot of testicular pain. Oh. Tons of it. And that's because if you think of the way that your testes, so when your balls drop, when you're going through puberty, when you hit puberty, I don't know if you remember, they descend through the internal oblique. So it hasn't happened yet. What's that?
It hasn't happened for me yet. You're giving me some future advice. Yeah. So
that's why you have no ball pain and you can lift so heavy.
I'm just hoping that one day they'll blast through.
Yeah, just keep Valsalving, it'll happen.
So that inguinal canal lets the balls drop through.
Mm-hmm. Yeah, so they descend through, and the cremaster muscle is an extension. So the one that makes your balls rise and drop with temperature.
When you cough, sometimes I think when you cough,
they'll raise when you cough. That is just an extension of your internal oblique, and that's a lot of reason why when people have trigger points in their oblique. So for people who don't know the obliques, that's the ones on the side here that my girlfriend's always telling me to work on.
It's the V-cut area, I would say. It's near the love handles, right?
But they'll get testicular pain. It'll refer into their testicle, and the issue will actually be up at the oblique. But in a lot of the heavy lifters that we're talking about, people who are lifting like their 500-pound whatever squats and holding their breath, it causes that pressure to go down, and men who don't have vaginas, the pressure pushes down and into that testicular cavity, and then people come to me with testicular pain, and we have to work on their breathing technique again and tell them, hey, if you don't want testicular pain, you need to dial back on how much you're lifting for now, and take a step back to work on your breathing through all of this. And a lot of times that's it. Like I can get through with someone with that alone in one visit, and then the follow-up is them coming back to kiss the ground at my feet and say how much it worked.
Yeah, which is you'll graciously accept that for no more than 15, no more than 15 minutes. So it's not
No ego.
necessarily what?
I say that with no ego.
Yeah, right. You got to let them do their thing, or else you're gonna be the bad guy. So when you so these people don't necessarily have hernias. They might be concerned that they could have one, right? Because they feel like testicular pain, right? But what they're feeling is this pressure because secondary to these concerns, right? So it's not a hernia per se.
Yeah, well, so technically it is herniating into that area. Like some of the abdominal contents can, and it's usually just a beginning sign of it. But otherwise, you're right. It's not necessarily a hernia in the beginning.
Okay.
But we try to catch it before that happens, and they're definitely susceptible to it happening.
How high up do you work with, like, so I know hernia, we have a bunch of different types of hernias. I have a patient the other day who had one like at the bottom of that V-cut area that your girlfriend wants you to work on. But he was definitely very developed. You know, he had probably like the end position for where you need to be.
He won, huh?
Yeah.
He did it. He won. Why are you still working out? Someone said, someone.
Yeah, was it Jim Gaffigan?
Comedian.
He's like, you won, stop. Or
Yeah.
maybe Kevin Hart, but I think Kevin Hart's too into fitness to make that joke now. But yeah, it's like a little outpouching that's like really soft, and it's right like above like the pubic area, but like on one side. And I guess that when I hear an inguinal hernia, or like the one that people talk about, like when they feel it like in their nuts, or like that would be, I feel like that would be deeper and harder to see. Would that, is that kind of a tough area for you? Because sometimes it's between maybe one that could be related to the stomach and the contents in that part of the body versus coming down, like the stomach and contents coming down into the inguinal canal itself and being more of a hernia like that.
So I think you're asking me like how do I differentiate?
Yeah, because I mean he was concerned. He was like, will this go away? Like, can you get rid of it with just PT? And you know, we all know about the mesh procedures and all that. And once you actually see it herniating visually, like a lump that's like a half of an inch high, to me, I would say that it'd be very hard to reduce on its own. However, I wouldn't be surprised if people have stories where it just goes away on its own, because the body does that sometimes, especially if you just take some pressure off.
I have not seen that, so I can't speak from experience. I can say that typically what I would go off of in distinguishing are like you had mentioned, symptoms. We go through our assessment, you know, palpation. I mean, you had a visual sign there, so that's a pretty obvious one.
Yeah.
But yeah, I mean, usually it's like their subjective history of what they do for a living, how they work out, where is the pain, when did it come on, what provokes it. But I mean, and that's the story for a lot of physical therapy stuff. It's usually mostly the verbal report where we can already infer, oh, okay, it's probably this.
Yeah. I mean, his came on during a deadlift. I was like, oh, this is very obvious to me visually, and your story. It was during a heavy deadlift. He like felt it that day, and since then it's been there. And he has this, you know, super werewolf friend that apparently werewolf friend.
Like the people that raised me?
Yeah, I think his name was Stolichnaya Varakoshev, and he was cousins with your parents, and because they're Ukrainian werewolves, remember? But
I was impressed that you remembered they were Ukrainian. That was good.
Well, I'm Ukrainian, so I mean,
that's why I picked it. But
did you say in here that they were Ukrainian wolves? I made that up on the fly.
Wolves. No, I'm pretty sure I said wolves.
Yeah,
I didn't say werewolves though.
I know, I'm adding to it. I'm sorry, but his buddy like had like a total for no reason. It got better, and once again, it's one of those things that I think it's probably not common to spontaneously heal on itself. But when you hear things like it happened during a deadlift, or when you were doing something with Valsalva, I was lifting all day and I looked down, like there's an outpouching on one side, it's asymmetrical. That definitely would lead me to believe some sort of herniation.
Yeah.
What are some things that you
I might refer that one out personally. Like if that was me, if it was that acute, I'd probably refer to like a gastro or something.
Yeah, just to take care of that whole, because I'll probably do something like a Doppler or something to make sure that it is what it is.
Nothing's getting cut off. Like
yeah. Yeah, right. That could be a concern too. So, sorry,
probably yeah, that could be. Hold on 1 second.
Hello, 911. I have my phone flipped up. I'm looking at my stupid notifications. I can't do that. It's terrible. Speaking of which, since we just talked about the phone, your Instagram is, as I would say, that it's 2020. Kids say things like lit. And you don't have a TikTok, do you? You don't have a.
I do, but I haven't used it because I'm starting to see gray hairs in my head, and I didn't know if I was too old to do it.
You've been removed from the platform, sir, for obvious reasons. It just looks
Very
wrong. You're talking about issues to do with
foxtrot and
back in my day. You're like a 1940s pelvic floor therapist. I mean, it's already a touchy subject. Once you got gray hair and you're on TikTok, things could get a little sketch. So yeah, TikTok's, it's gonna get removed anyway. We'll see. But your Instagram is very entertaining. I hope people understand this. I'm a therapist myself, and I follow a lot of people, but Nick's is really cool because he deals with interesting things. And lately, you've been picking it up. You've been doing a lot of live videos and infotainment, as I call it. Actually, you're at the DeKalb Farmers Market in Atlanta. That place is awesome. The international.
Oh, you've been?
Yeah. My ex lived in Atlanta, so I would when I visited, we went there a few times, and it was awesome. I would move to Atlanta just for that. I swear.
Really? Well, you know what? If you ever need a place to stay, it's like in walking distance of my house.
No way.
Yeah.
I should have visited you when I was there, but
I was in the sausage section.
You worked there. Yeah, pelvic floor pizza and sausage packer at the farmers. It's an honest day's living,
Right.
Well, with the amount of debt we get, that happens sometimes. But so you, in your last Instagram video, we can just talk about this now because I think it was interesting. You had an interesting contraption. How about, so I avoid saying it myself, how about you explain to the audience what an example of some of the stuff you include, which is very educational. What were you doing yesterday? Because that was cool. That looked awesome.
Maybe you should go buy one.
Actually, it was like a shrine.
I happen to. So it was a penis pump, and it was. You all right?
Not that video. That one was private.
The one my family?
Yes. So what are you talking about?
It was a video of a penis pump, and I had talked about it as an alternative for people who have a tough time with the side effects of Viagra, or maybe Viagra just doesn't work well for them, or it's contraindicated as a medication for them. But as an alternative for that, for achieving an erection for intercourse. And I talked about it a few weeks ago in my car. So I did one of those Instagram lives that you were talking about. And I decided, why am I not showing it to people? Like, people are going to Google it. They're probably not going to get it. They're not going to know which one to get online, whatever. So I decided that I would walk into a sex store and see what it was like for us as the consumer, the people who I tell to do it. So, because sometimes I tell my patients to give it a try, and just to see what that experience was like, as well as get a penis pump so I could demonstrate it, not on a penis, but on a condom. I wanted people to see what the principle was, because I described it, but some people are like me, they're visual learners, or they need to fail 50 times before they figure it out. Mm-hmm. And so yeah, I got a condom, I put it in and I pumped it up, and I showed how the condom was able to inflate, even though we weren't blowing it from the other end. The suction caused the flow into the chamber, and in a penis's case. it would be blood into the penis instead of air into a condom. So yeah, I was just trying to find a way for people to be able to see and understand, and make it less taboo for them.
Yeah, you're the guy that you're like the guy that dies for us here. You gotta take the risk for us. I like that.
Yeah.
You're the martyr. So it's kind of like cupping. It's like cupping for your, yeah.
It is exactly it is coming for you. It is exactly that, Rob.
The only thing is that when I do cupping, I can use it on my advertisements. And I don't know if it would be appropriate if you were advertised showing you doing that kind of cupping. You could do it with a condom, I guess. That'd be interesting.
Right. So I should say, before people get confused, I don't do that treatment for people.
Sorry. I didn't mean to make it seem like
I
that.
could totally see how someone might think that and then show up and be really disappointed.
No. You got to actually buy it yourself and do it yourself.
Yeah, and it was cheap. I mean, it was $18.95 before taxes came out, to about $20 after taxes.
Wow.
It came with the cock ring and everything. It was the whole setup. The chamber, the cock ring.
Is that useful in any sense in terms of, I mean, I guess anything that forces blood would be a useful thing, correct? For this particular pathology.
Or is the pump useful?
The first thing you said.
The cock ring?
Yeah.
Okay.
I'm like trying to be all slick and avoid saying it.
Yeah, absolutely. No, you're good. I mean, just
this is why Nick is so good, because it's just like you're cool about it. Yeah, it always is. Just right now it's coming up, so that could be useful too. Anything that aids in that situation, I'm sure would be great.
So the cock ring, what it does is it prevents the backflow of the blood. So the vacuum pulls the blood into the penis, and then the cock ring goes around the base of the penis to prevent venous backflow of blood out, because what makes the penis hard, it's blood. So it's actually a liquid thing that's going to flow in and out, even though it's nice and rigid. And the cock ring goes around the base, like I said, to create pressure around the base of the penis and make sure that the blood doesn't necessarily all flow out right away.
So that is like blood flow restriction training.
There we go. Man, you're bringing it all back to the gym. I love it.
See, everyone, blood flow restriction training is the same thing. Yeah, you tie off a limb, Does that count?
Yeah, I have some cuffs here for blood flow restriction training too. So
so you can do it all, man. That just goes to show you that this stuff it goes across the whole body. It's not like when it has to do with the pelvic floor or an embarrassing area, all of a sudden it's like some weird invasive technique. It's the same stuff. You're just kind of repurposing it, and you got to have someone that can handle the way to talk about it. So that's good that you do that. Because I don't know if I could, maybe with my boys we'd joke about it, but nothing public like this. So that's good. You gotta really shoot the gap.
Public? Are you posting this?
It's being live streamed on TikTok. Watch out, you're gonna be done after today. I don't see any gray hairs, by the way.
Oh, thank you. Yeah, they're coming in on the sides. They're there.
Your hair is very black though, so I think that any gray hair would show up very, very easily. Well, so now for girls, are there similar contraptions? What about this egg thing that I've never heard about and we've never talked about on any other TV shows or podcasts?
The egg? Are you talking about the jade egg?
Yes, the nice porous jade egg.
Yeah. So you already know.
It will, but the audience doesn't know. We talked about this before, because I mean, I think the equivalent for a girl, like that kind of stuff for a guy, the equivalent for a girl would be something where you're squeezing down too. And that's what the jade egg is. And that was created by some celebrity, correct? Gwyneth Paltrow?
Yeah.
And people just Google it and they want to do it, but and it's not good for you, apparently, according to Dr. Nick Vernola, circa like 4 months ago.
And a lot of other people.
And a lot of other people. It's not like you're the only person that knows this.
Yeah, I don't want everyone to think that I was the genius that thought of how bad this was. No, but yeah, it's jade's a porous stone. So when you use it, your vaginal fluid or whatever lubricant you wind up using to place it can wind up staying in it. And even though you clean the outside of it, so the surface of it, there's still that liquid in there, which there's bacteria in, and then it acts like a petri dish and it just cultivates over time. And now you're just putting a jade probiotic in your vagina every time you use it. And it's just gonna mess with the vaginal flora. It's just, it's horrible. It makes my skin crawl. It makes me angry just to know that someone tried to monetize something like that, like, gain financial value off of harming others.
Yeah, right. It's a classic celebrity move. It's like watching a celebrity trainer sell something that's stupid, right? But now this is a little bit more serious because you're really messing with things.
Yeah, exactly.
So how about tell people a little bit about your business, Thomas PT, because I know that you're located in Atlanta, and this is a South Florida, Miami show. Because I just wanted to niche it down, but it's information that's good for everyone. Yeah. So you're not necessarily a competitor with me. However, you consult people, you help people all over the world potentially. You could if you wanted to. So why did you decide to make your own business related to this stuff? I mean, you could have easily found a great job in a hospital or something. Why did you want your own clinic and to do it your own way like this?
I was honestly just looking to be able to be my own boss and provide my clients with what I thought was necessary, and not have it dictated the time that I can spend with people, the treatments that I give to people. I didn't want it to be dictated by someone above me. So it was my effort to put the autonomy back in the patient's hand, because we keep a good rapport on what we want to do and what our goals are. So it was ultimately a decision to try to get autonomy back for the patient and be able to work through the things that they actually need and give them the things that they actually need.
Yeah, because now instead of you having a boss, your patients are your boss. That's what I say.
That's right.
It's like,
instead of having one, I have a bunch.
I know, that's what I was going to say. That's the thing I noticed too. It's like, everyone's like, oh, you don't have a boss. That's amazing. But it's like, well, now my boss is like all my patients, and I have to advertise to get them. It's like, please, I want a boss. I need someone that needs me. So yeah, that takes, for lack of a better word, and because of today's episode, it takes some balls to do it, to open up a business like that.
Full circle.
Full circle, man. Just like the pelvic floor, circular region potentially.
That's true. Pelvic inlet, pelvic outlet, where the musculature lies and the organs for the pelvic floor.
Oh my God. In terms of, we haven't really gone over some of the basics here, but the pelvic floor itself is created by a lot of muscles, right? I mean, when I think of it, I kind of get overloaded myself, and we hear a lot of cues and things from Pilates instructors, yoga instructors, PTs, personal trainers. And I think that in general, if I had to guess, I feel like a lot of it's probably not the best cueing. And one of the biggest cues you hear is like, pretend you're pulling your belly button to the floor for your transverse abdominis. And for your pelvic floor, it was like, pretend you're pulling up like from, I don't even know the cue, but pulling up like towards, like up and in, like you're trying to pull your balls up for a guy. And I don't even know what you'd say for a girl. What are some of the misconceptions and like cues that you give, like to combat those things, for pelvic floor activation for people?
So I'll start actually by going over like what I actually advise people to do more often than less, which is not to try to contract their pelvic floor before they get to a physical therapist, because usually they're actually very tight as well as weak, but usually the muscle itself is very tight and it needs to relax. So I'll tell people to work on, like we talked about, diaphragmatic breathing, but for a different purpose. So that's been shown to decrease muscle tension by breathing through your abdomen. It helps stretch the pelvic floor a little bit, as well as activate it. Slow pranayama breathing is a really cool one. I'll have people do resisted breathing. So they'll breathe in through one nostril, 5. They'll breathe in through
2 noses. I knew it.
You got me. So resisted breathing, so they can do their diaphragm still, but it provides a little resistance. It helps activate the rest and relax nervous system. And exhale through the pursed lips, trying to elongate both the inhale and the exhale, again, to help relax the muscles of the pelvic floor. Getting into activation though, trying to make sure that people understand that they should not be using their buttock muscles to contract. They should not be using their inner thigh muscles to contract. So I'll usually tell them to slow down and do a light contraction, if anything, because what happens is people try to do this all or nothing contraction. They forget that there are layers to the pelvic floor, and then they'll start bringing in their buttock muscle and their inner thigh muscles.
Yeah.
So I'll usually say, try to pinch as if you were trying to slow the flow of urine, not stop it, but slow the flow of urine. I can see you trying it right now.
No, I would never.
But for men, it's they seem to respond best to contract like you're trying to make your penis jump.
Yeah. Because that's such a bro thing, right? Every guy's messed with that kind of stuff. So you're trying to just relate to your patients, huh?
Yeah, exactly. I mean, that's what it is.
But you probably don't want, when they're doing it, you just tell like a light penis jumping squeeze, and then they'll do that.
For women, like you're trying to slow the flow of urine.
Okay.
Slow it though, not stop it, because that's when people start contracting too hard. And then just get into the most relaxed position possible. Make sure your legs are supported, so that way you don't feel like you need to hold your legs. Because even hook lying, when you're hook lying, you need to prevent your legs from going to the outside. So like lying on your back with your knees bent. Mm-hmm. So people are already engaging when they're like that. So I'll tell them to try to put their legs resting up at about 90 degrees, their hips and knees on a chair or something, and just lie on your back and try it from there.
Eliminate all dependent position, eliminate all things that could possibly contract or have a muscle contracting that's not the pelvic floor. Because you said you usually don't want people overly contracting the pelvic floor because it's already pretty tight. So the breathing stuff, but you will cue the pelvic floor contraction very lightly, just like slowing the flow of urine, especially I'm assuming for people with incontinence, right?
Yeah,
so you will work on that stuff. Okay. And when they're lifting heavy, for example, so once you start transitioning them to squatting, let's say it's a CrossFit athlete, you've gone over breathing, you've worked on some pelvic floor stuff, and now you're transitioning them to the squatting. And I think you were saying earlier a little bit about taking it easy, but would you want them to think about those things as they're doing it, like the breathing techniques, like the pursed lip breathing and then the contraction of the pelvic floor as they descend and come down?
Yeah, eventually we would get to incorporating that pelvic contraction. So the contraction would come with the exhale. So you do your pursed lip while you're doing your contraction. They work well together. So you're keeping the pressure in your abdomen low while also increasing the pressure around your urethra high. So that way the bladder, if there is any pressure above when it squeezes, it doesn't get past that muscle. But that's something, like I said, that I really want to make sure that they're able to isolate it. So you have to remember, when you're doing a squat, there's no way around it. You're going to use your glutes. Every time you use your pelvic floor, but I want to make sure that people are able to contract and relax it in isolation of those things. So,
yeah, with anything. I mean, with regular musculoskeletal outpatient orthopedic PT, a lot of it is working on selective contraction of each muscle. Even if it's just in pain, it helps your brain, it helps the pain response to learn how to control and contract certain areas and muscles of the body. And that's why a lot of times, like with like pelvic tilts or pelvic clocks, you tell people to try to use as little muscle as possible. And you have them in hook lying, but it seems like better would even be supported legs. And they're doing these motions, and they're just trying to use the smallest amount of muscles. So only the muscles that you're trying to target, you're supposed to work, are working in those like moments. So I could see the benefit. So we have incontinence. We have some of the other things we talked about too, with the penis pump and all that, and even the egg thing. What's like the next biggest condition that you think goes under the radar? You know, you went over all of them earlier, but what are some things that you think people have, maybe they're too embarrassed to get fixed, or they don't realize is a pelvic floor issue that you see and people are actually referred to?
Orgasmic dysfunction.
What? Really?
Alone. That's a genuine, like, out of
It's like anything you say with your concentration, anything you say will make me like, oh my God, here we go.
Is he serious?
Yeah, right. That's the thing.
That's a
You
big
have such a
one.
dry, sarcastic sense of humor.
It's like
And so do I. Yeah, people don't take me seriously sometimes because I'm like, they like, oh, he's joking. When you're talking about the stuff you're talking about, like, it's gonna be pretty hard to say something without dropping that hammer with the orgasmic dysfunction. What? So they don't even realize it's an issue. Do they notice a change?
So usually it's people, generally women. I just actually did a podcast with a sex therapist recently about it.
You have a podcast yourself?
No, I mean, I guess I should just say like a video interview would be a better.
Okay, but it's still around. It's out there on social media.
Yeah, it's on Instagram, on Instagram TV,
IGTV,
and my Facebook page.
Timeless PT.
For Facebook, it's actually Timeless Rehab. Someone took Timeless PT, but on on Instagram, it's Timeless PT. So
okay, good. So people check that out if you have this orgasmic dysfunction. Wow, that's funny. So you're explaining. Sorry, I interrupted. I just want you to be able to get these little shout outs for yourself out there because I usually forget.
It's all about me.
It is. This is about you. You're the guest of honor today, sir.
No, I'm just kidding. But what does it say is just that it's one of those things that people, they may not like to talk about it. They think something's wrong with them, which I hate that idea because there's nothing wrong with not having an orgasm and maybe having a different focus when it comes to sex. But there is also a lot that can be done for people who are having difficulty or have never attained an orgasm. A lot of it is really just self-exploration, for women, getting in front of a mirror with their pants off and just exploring their anatomy and seeing what different areas of because you'd be surprised, a lot of people just have not looked at their vaginas before. It's not as easy for them to see, like young teenage boys who are exploring themselves through puberty. You just look down and it's there. But for women, it's a little more taboo. It's a little more hidden. So getting down in front of a mirror and just trying to, look and understand and feel and kind of just understand, like I said, that unknown area and see what feels right for them.
So this isn't even really like this isn't like a classic, like for example, incontinence and other physical therapy related conditions in general have some sort of, they typically have like a musculoskeletal pathology or like a neurological one. But you're saying that people come in just with like a lifetime of issues with orgasming, and then they just need to like explore. Like this is something that they could have, if they had the right wherewithal, they might have been able to work on this. It's just interesting, you know what I'm saying? Like it's not like it's a musculoskeletal pathology, like a muscle is weak or something. It's like they just haven't worked on themselves in that sense. Is that what you're saying?
Yeah. And you know what? Guided masturbation, which is what I just described, is actually really well supported by the literature that I'm familiar with. So one of the best ways to address orgasmic dysfunctions or anorgasmia, the lack of or difficulty attaining an orgasm for females in this case, has been to do what I just described, which is guided masturbation. So again, a tip for people that could save them, going into have to see a physical therapist, which is nice.
Although I would still want to see you. I'd still want you to help me with that. Do guys have that issue? Is that like a thing? Yeah.
Yeah. I just worked with someone today, actually.
Oh, wow. Okay.
Yeah.
So they just, interesting. It's probably,
perfectly functioning erection, just very hard time attaining an orgasm. Yeah.
Interesting. So you just then you give that same advice, but just obviously you don't tell them to look for their vagina. You tell them to look for your penis.
It's a little different. So it's person to person. So it is always good to get things checked out and go see a physical therapist to decide if that is right. For this in particular person, we've discovered a lot of tightness in the muscles that the pudendal nerve passes through. So that's the nerve that goes to the penis. And
S2, 3, 4.
Yeah.
Keeps the penis off the floor.
There you go. That's good. But yeah, trying to just talking about different ways that we can try to relax those muscles, stretch those muscles, because he was someone who was very tight, like I said, but also weak.
Mm-hmm.
So trying to just learn how to isolate those muscles and kind of loosen up that area to see if we can get a better flow through of the connection between the penis and the brain.
Yeah, that's a big deal. I mean, that's the whole thing right there. I mean, when you see S2, 3, 4 pudendal nerve issues, is it accompanied with other things, like a little bit more south of the border there in the rear end region? Like, is there any anal concerns?
Well, so that's what I probably wasn't clear, but that's the muscle I'm talking about, is the pelvic muscle. So we do a rectal assessment to assess the levator ani, so the muscle of the pelvic floor that we've been kind of talking about, and not the one that goes around the penis itself. And we may get there, but to start, we went to the levator ani and we looked at the obturator internus. It's an internal hip muscle that you know of. And we found that it was very tight. So we needed to learn ways to relax that muscle and ways to self-stretch instead of having someone such as myself doing, different types of relaxation, lengthening techniques.
Which isn't ideal. They'd rather probably do it on their own. They'd probably rather be proficient on their own.
And I mean, in the literature, as you know, for any of these conditions, even the ones, that are general orthopedic, active treatments where the patient is an active participant have much better outcomes than those where they're passive, where it's just you doing a stretch or a massage, range of motion, things like that. Yeah,
exactly. The patient taking control of their recovery is what matters. Because if you develop some kind of control over your condition, especially if you're able to self-treat, that leads to way better outcomes than passive treatments that you might have to have them come in twice a week for like ever. So, and that is better for the patient too. They save money, they save time, they get better quicker. They have self-efficacy in their treatment. It's a win-win for everyone.
Oh yeah.
So what is an obturator internus stretch that they can do on their own? That's really specific, but like it's amazing that you're able to determine that muscle was the culprit, because that palpation skill must be insane, especially in that area. How would you even palpate that? Is that the way I think it would be, or is it? Yeah. Okay.
We will operate off of a clock system. I mean, I don't know if if anyone listening wants to know this, but it's you go off the clock system where the tailbone would be 6 o'clock and towards the genitals, so like the penis, the clitoris, would be 12 o'clock, right? Mm-hmm. So if you're looking at it from, if I was on my back right now and you're looking up at me, so 12 down would be 6, and then just kind of go.
Oh, it's okay.
Mm-hmm. It's like that. So you would identify. It's called the atla arcus tendinus levator ani.
Oh my God.
That one of the levator ani muscles originates off of, because there are really 3 levator ani muscles. But we don't need to get into that much detail about it. But it runs underneath that and then outside of the pelvis and onto the back end of the hip to help externally rotate.
Wow, that's amazing. I never thought I'd be able to. Obviously, I've never done that kind of palpation, but there's the superior and inferior gemellus, right? The obturator internus gemelli, the gemelli twins. Are those your cousins?
Yeah.
And then
Mario, we just saw the Italian people running around.
It was the Italians. It was a big deal for Italians when they discovered that muscle. They were like, they have Christopher Columbus, and he's old news now. So now we got to focus on gemelli. Maybe they could put a statue of him up somewhere.
They probably could.
And then your quadratus lumborum. It's amazing. All these little muscles that originate and insert there. It's like you wouldn't even know how big of a deal they are, but it makes sense because there's a lot of small contractions that take place in that area that are very important. So, so that's
And we
interesting.
do dry needling to those muscles too from the insertional point, so like towards where they attach on the external hip. So there are treatments for that.
Less invasive.
Yeah.
Than doing it from the origin.
You mentioned one for people who are listening, like stretches that they can do.
Yeah.
Internal rotation stretches. So where if you were sitting and you were to rotate your feet outwards and away from each other, that's one way to stretch them. You could do, I mean, really any rotational head stretch would be good.
Yeah, kind of like yeah, I could imagine, like, you know how kids like W sit, they sit up with their legs rotated out. That'd be like the extreme example. So they're like diving their knees together while laying on their back or sitting up. I would assume would be stretching those muscles because you're internally rotating, and those muscles are being stretched in that motion. Okay, interesting. Yeah, no one ever works on that.
So, I mean, like bringing your knee up and towards your chest and over can get it, but all to your own tolerance.
Yeah, it's crazy. Do you see any back pain from pelvic floor related issues? Like, is there any kind of connection there that you've seen?
Yeah, definitely. People I noticed that post hysterectomy, there's a lot of back pain related issues, but that's something that I haven't really been able to make like an empirical kind of research based decision on. But I always think that because you lose that the uterine ligaments around, so that extra support to the pelvis, there might be some low back sacroiliac joint pain that ensues from it. And some of the muscles of the pelvic floor do refer pain to the lower back. So yeah, sometimes we have to work out some trigger points in the pelvic floor.
Wow.
And there are some stretches people can do externally. I'll tell people, if you're someone at home who, for whatever reason, thinks you may have a tight pelvic floor, you can grab a tennis ball or a lacrosse ball, and you find your sit bone, and you put it kind of between that hard spot that you sit on and the genitals. So it's kind of like right in the middle there. Ooh. And you sit down on it gently, and you can roll forwards and backwards, and you find a tender spot, and you just hold it there for 30 to 60 seconds. Repeat on the other side. You can go back and forth how you feel.
This is to get what again? What particular muscles?
Levator ani.
Wow. Okay.
So the pelvic floor muscle.
Yeah, the one that gets vagued all the way to just pelvic floor muscle. What about a couple more questions, because you're bringing up things that I want to learn about, and I think that my mind really aligns with my listeners, all four of them. So when you post-pregnancy, what do you see in post-pregnancy? A lot of, I mean, that's like I said earlier, like this post-pregnancy issues. I've heard, I mean, we hear about with pregnancy, sometimes you get the tearing effect between where the baby comes out of and where you drop things in the toilet from.
Say it.
The vagina.
There you go.
And the butthole. I like how sometimes you mix in like the casual term, like you'll be like butthole, and I'm like, anus? You say it? I'm like, what are you trying to say? Cock ring. Oh God. So do you treat patients with those problems? Is that common, or is that kind of because people make it seem like it's very common? How common is this, and do you treat it?
Yeah, true. Yeah, so a lot of people, after they either vaginal or C-section deliveries, the pudendal nerve gets stretched. I think it's like between 3 and 5 times its original length. So there usually is some amount of nerve damage to that nerve, which means that you don't activate the levator ani as well as once before. It just takes some time for healing, but usually you'll see the stress incontinence. So people lifting their baby off the floor after doing playing in prone time, they'll lose some urine. Some people get fecal incontinence, so they lose control of their bowels. The biggest thing I would say that I see would be somewhere between that, but also the effects of the diastasis recti long term. So maybe I'll see someone a year after they delivered, and they're starting to carry the baby up on the hip, and the rectus abdominis isn't lining up quite right because there was that splitting between them when they were pregnant. So we'll work on that too. The research that I'm familiar with for the diastasis recti is wearing an abdominal binder, like a really tight one, for 23 hours a day for 6 weeks.
Wow.
I can definitely say that a lot of people's symptoms subside after that. Making sure that you have a good core routine, because remember, you get that false sense of stability with the increased pressure.
Yeah.
But make sure you have a good routine. But wearing it for that 23 hours a day, 6 days a week, I mean, I've seen them reduce from 4 to like 5 finger diastasis recti is down to like 2.5. So definitely something to be said about that.
Yeah, we see that ballooning. Diastasis recti is definitely something I see in a lot of my, I see a lot of like older men too, kind of with the beer guts. They'll have, could that be a result of chronic constipation? Really? Wow, geez Louise. So yeah, because I mean, it's like I see dudes that it's like you could fit 3 fingers in there, and it's and they always wonder if it's going to go away. But it seems to me that it would take some significant intervention to make that happen.
I mean, between figuring out what was causing it from the first place and addressing that, as well as doing the abdominal binder, to fix it. But otherwise, if you don't figure out what it was doing in the first place and they're still constipated and straining all the time, it is going to come back. So
you're more likely to get someone who's constipated. I'm assuming that would be worse because it's like in terms of weightlifting, you're probably pushing harder with your Valsalvas, but you're also very active and there's other muscles being engaged. But when you're sitting on a toilet at a 90-degree bend and you're just, that's probably a little bit, you probably have less external supports, I'm assuming. Is that why that is more of an issue in that population, I'd say?
I don't know that I would say I see it in one more so than
yeah?
So I couldn't really say. I'm
making an incorrect assumption. Oh my gosh. I'm sorry.
I mean, you could be right. You could be right though. Maybe you saw something that I didn't.
well, this brings me to another question, almost my last question. When you have people sitting on the toilet, there's been this invention. We talked about this, I feel like, in a past life. Yeah. What do you think about the Squatty Potty? Is it actually effective?
Squatty Potty. Mine has foot massagers and a magazine holder on it.
Oh my God. You would have like all this stuff maxed out. You bought the $25 version.
It's got spinning rims on it. Hydraulics.
We got a big one today, boys. Had big dinner yesterday. Boom, click it. Just goes all the way up.
Yeah.
Your knees are touching your chin. So that works, huh? It doesn't open up the gateway there a little bit?
So to speak, yeah. Actually, honestly, no one does it better than the Squatty Potty commercial. They really do explain it well, and I love their visual. But it does, so it puts your hips in the position where the levator ani, so the muscle that the colon passes through, the rectum passes through, it puts it in its most relaxed state. So the angle of the colon at the end there doesn't necessarily, it's not as sharp. It's more up and down, so things can kind of slide through a little bit better. So yeah, absolutely. And honestly, I've set up for biofeedback. I've set up people in my office, not on the toilet necessarily, but I'll make a mock toilet in here, and we'll get them into positions with the biofeedback probe to see what is the most relaxed position for that person. So that's a lot of fun. Toilet ergonomics.
Right? Who'd have thought? I feel like it's got to be pretty rewarding doing some of this stuff, because it's like when people have issues with GI stuff or going to the bathroom or sexual things like that, I mean, it must be very relieving to see any kind of improvement. And it's one thing to have a shoulder issue, but when you can't go poop right, man.
No, and you know what? It weighs on people. I mean, there's a psychosocial component to it too, because I mean, it holds people up from wanting to go out and do the things that they can do because they're afraid that they're going to get stuck in the bathroom at some point. So it's way more freeing than people see up at the surface of it. There's usually something deeper to the functionality of it.
Yeah, and I'm sure you've taken people from having to do things like wear diapers, and then they don't have to wear them anymore.
Yeah,
Wow.
yeah, and then they save money. They don't have to buy diapers anymore.
No diapers, no that embarrassing frilly diaper coming out the top of your pants. That's always, that's not good for a youngster. So let's hear, this is always a tough question because it's extremely vague.
Where did babies come from? The stork.
Yeah, the stork. I knew it. I heard this one story. Had to be a lie. No, this is for the Instagram clips. We need a little 1-minute explanation. You know, people love the clips. People love hearing the quick blurbs. They love the controversy. And I already have a lot of controversy in this episode. We talked a lot about sexual stuff. You said the COCK word, which is going to be fun. But if you had one piece of advice for your most common client, let's go back to the like the weekend warrior weightlifter, for example. Like what's the biggest oversight that these people have? If you had to give them a piece of advice to avoid needing to go to any kind of pelvic floor therapist or anything like that, what would you give them?
I would give them the golden ticket.
The Happy Land.
No, Willy Wonka. The biggest piece of advice that I give people is to slow down, look at your form, because a lot of times people know. A lot of times people know what they're doing is not correct. Mm-hmm. So slow down, take a deep internal look at what you're doing in terms of your breathing, your posturing, your form, and you don't even need to look at the pelvic floor. Take a look at your whole body first and how you're doing what you're doing, and work from there. So just slow down, quit trying to speed up all the time, and just take a good deep look at how you're doing things and correct the things that you know need to be corrected.
Oh, I like that. That might have been under a minute too. That might have been 59 seconds. So this is very good. So if people want to get in touch with you, because I have listeners from all over the world, my mom. That's it.
Soon to be my mom. Not your mom, but I meant like my mom would be a listener.
I was confused. I was like, wait, my mom's going to be your mom? I was like, let me think.
This isn't
are you going to marry my sister? What are you going to do? They're both taken. Sorry, you waited too long. I knew this was what it was all about. You dirty dog, you. What was I saying? Oh, yeah.
If people want to get a hold of me.
If people want to get a hold of you, if they want to learn a little bit about you. I think I do have listeners in Atlanta. You know, I do have a connection down there. You, for example. Nick, Ryan Brennan as well. Another friend we have over there. Give us the links to your social media again, or the ways that you like people to contact you. So at least if there's like a referral, or if you can help someone in that region, or you're in your state, because, you know, telehealth is a thing. You could help anyone in Georgia from any distance if he needs to. And I'm sure you could give advice to anyone if they need it, at least where to go. What would be the best ways for people to contact you?
You can get a hold of me on my website, timelessphysicaltherapy.com, or timelessphysicaltherapy or timelesspt.com will take you to the same thing. I'm actually pulling up my own phone number right now.
You don't memorize it. Come on, man.
You can call me or text me at this number too. It will direct to my cell phone. It's 404-390-0255. And I mean, you can look me up on Instagram. My handle is timelesspt or Timeless Rehab on Facebook. I have a Twitter that's timelesspt as well. You can email me. It's nick@timelesspt.com. we try to keep it consistent.
As much as you can. People.
And then the most common way people in Atlanta do it is if you go to the commissioner's office, there's a spotlight there, kind of like Batman.
Mm-hmm.
You can angle a picture of the image of a giant, in the air.
I was like, he's gonna say it. Is he gonna say it? And then you show up, right? Like you're the guy that does that. I want to see your suit for that one. Do you remember SNL from like the early thousands or 90s? They had those two ambiguously the duo. You don't remember that? I'll put it in the show notes. It was they had like a plane that looked like a big penis. So maybe maybe you could just like buy that off of them. It was a cartoon though, so it'll be tough.
Might be some copyright stuff, but I can
the infringement. Well, once the Batman spotlight comes up and the copyrights are out the window, you don't want Warner Brothers coming after you or Disney. I don't know who does Batman.
I think it's Warner Brothers. I think they still have Batman.
They're still grasping onto that. Yeah, that's all I got left.
Don't let it go.
We have Batman. Where is he? So that's good. We have some ways we can reach Nick, and I'd like to thank you for coming on today. Bunch of great information. It was kind of disorganized because things pop into your head when we talk about this stuff, and I want to know about them. So, we learned a little bit about everything, girls and boys, and all that stuff. So, I would love we come back on the show. You could even do we can do one with a couple other people. We both have a friend. We both have one friend named Ryan that also the personal trainer. Smiling Ryan. He smiles too much. And we can probably find some middle ground where we could talk about the transition between, training and overall health and wellness. So thank you very much, Nick, for coming on today.
Thanks for having me. I had a lot of fun. It was always a pleasure talking to you, Rob.
Yeah, man. No, it's awesome. You dressed up. I like that you dressed up there in that suit. Do you wear this to work every day?
Oh, these are my pajamas.
Oh my gosh. I can only imagine what you look like at work. You got the collar open, like you're kind of like an everyday guy. Like you didn't want to have this job, but you got to do it just to help people. So I like that. Like you're taking a break between your stock trading during the middle of the day. Well, thanks very much, Nick. Once again, Dr. Nick Vernola. Check him out on his social media links. He's extremely entertaining on the Instagram page that I follow him on. So I think that you guys should look into at least the Instagram, then you can follow everything else from there. Once again, Dr. Nick Vernola signing off with Rob Poliszuk, physical therapist. Thanks very much, Nick. Any last words? That's a tough question.
No, that's it. Thanks for having me. I appreciate everyone who listened. And get a hold of me if you need anything.
All right, buddy. Have a good one.